Good day everyone, I'm your nurse for this morning and I will be performing a return demonstration of mouth, sinuses, and nose assessment. So good morning sir, I'm your nurse for this morning and I will be performing a return demonstration of mouth, sinuses, and nose. And if you feel uncomfortable, feel free to raise your concern. Is it okay sir?
Yes.
So now we will start our assessment by inspecting the patient's lips, teeth, and gums. Okay, sir, so can you please smile? Okay, so can I touch your mouth, lips and chin?
Yes.
Patient's lips are smooth and also his gums are pink and there's no any lesions or swelling, and also his jaws are aligned with no deviation seen. Second is we will inspect the patient's buccal mucosa using pen light and tongue depressor. Sir, can you open your mouth? Okay, thank you, sir. So the patient's buccal mucosa is smooth. There is no any lesion or swelling. The third one is we will inspect the patient's stents and ducts using again the tongue depressor and pen light. Okay, sir. So can you open your mouth? Thank you. Open. Thank you, sir. So for the result, the patient's stents and ducts is there's no redness or swelling. All in all, it's normal. Okay, so for the fourth one, we will palpate and inspect the tongue of our patient. Okay, sir, so can you open your mouth? Stick out your tongue. And is it okay if I touch your tongue using your fingers?
Yes.
Okay, thank you, sir. Can you close your mouth? The result is the patient's tongue is pink, moist, and there's no lesions present. So for the next one, we will inspect the ventral surface of the patient's tongue. Okay, sir, so can you open your mouth? Sir, can you touch your tongue to the roof of your mouth? Okay, thank you. Okay, thank you, sir. Close your mouth. Patient tongue ventral surface is smooth. There is no any lesions. The veins is visible. And for the next, we will inspect the patient Wharton ducts. So, okay, sir, can you open your mouth? Can you touch your tongue to the roof of your mouth? Okay, sir. Okay, thank you, sir. So the result is the patient Wharton ducts is visible with the salivary flow and there's no any swelling, redness, or any pain. Then we will check the side of the patient tongue using a square gauze pad or any clean tissue. So can you open your mouth, sir? Can you please stick out your tongue? Is it okay if I hold your tongue?
Yes.
Okay, thank you, sir. Okay, thank you, sir. So there's no any lesions or ulcers on the side of the patient's tongue. So for the next one, we will assess the hard and soft palate of the patient and also his uvula. Sir, so can you open your mouth? Okay. Can you say ah? Okay, thank you, sir. Close your mouth. So for the result, there is no unusual and foul odor. His uvula is fleshy and there is no redness. For the last one, we will inspect the patient's tonsils and his posterior pharyngeal wall. So okay, sir, can you open your mouth? So stick out your tongue, sir. Thank you, sir. So for the last result, there is no any lesions on his tonsils, Also, his throat is normally pink and there is no also lesions. So the next one is the nose and sinuses assessment. But before we proceed, we will discard our glove and perform a hand hygiene. So the first is we will inspect and palpate the external nose of the patient. So, okay sir, can I touch your nose?
Yes.
Okay. Do you feel any pain as I touch your nose?
No.
Okay, so thank you sir. The color of the external nose of the patient is the same as the rest of his face, and there is no any tenderness or pain. So the second one is we will check the potency of airflow through the patient nostrils. So sir, can you try to occlude the side of your nose and try to sniff or exhale? Okay, to the next side sir. Okay, thank you sir. The patient can able to sniff through each nostrils while the other side is occluded. So for the last one, we will palpate and percuss the patient's sinuses. So sir, can I touch your face?
Yes.
Do you feel any pain?
No.
Okay, thank you sir. The frontal and maxillary sinuses are non-tender to palpation. There is no any crepitus or lesions. And also the patient's sinuses are not tender as I percussed it. So for the documentation, we will record all the results